Miigwech Nicole, thank you for a very informative and enlightening look at traditional medicine, something that is a very sacred gift that many of us want to know more about and want to come to understand. So Miigwech, again, it's a real privilege to have hosted your talk. I can see that there's a few questions, and with no more hesitation, I think I'll jump right into those. So I'm seeing questions on screen, and so I will begin to ask those of you, Nicole, and so I'll just pass them over to you. So the first question is something that started early in your presentation, and I almost missed it myself. What was your elder teacher's name that you honored with her photo at the beginning of your presentation?
Yes, her name is Bessa Blondin. She's Satu Dene, originally from the side of Delaney, Great Bear Lake in the Northwest Territories. Bessa Blondin.
Thank you, Nicole. Here's another question. It begins with, thank you so much for your work. From your perspective, how should traditional medicine, and in particular for mental health, be modified? What can we learn from Indigenous views to enhance our practice, looking at how to integrate your wisdom, as opposed to having more parallel processes, which I acknowledge is very important as well?
I think it's a great question. I encourage people, there's a YouTube video, and if you type in Arctic Indigenous Wellness Foundation on YouTube, it'll come up with a 10-minute video on our urban healing land camp, and some of our traditional counselors will talk about the mode of traditional counseling that's used at our camp, which very much differentiates itself from some of the Western structures that we have in mental health. And I'll give you one quick example, and that's William Greenland's one of our traditional counselors, amazing Wiccan young elder who's also an amazing flute player if you're ever interested in listening to some very incredible Indigenous flute playing. He often says, you know, we don't ask people what their problem is when they come to see us. We don't ask them, you know, what's going wrong. We don't ask them what's bringing them in. What we ask them is what's going good in their life. You know, what are their strengths? What are their things that make them well? And I think that in and of itself just explains the differential between the different approaches between mental health within the Western view, where you're often coming in with a specific problem that you want to discuss about, comparatively to the Indigenous way, where we're trying to build people up, build up their strengths. And then slowly but surely, some of that healing will start to come through some of the other stories or the impacts that they've had in their life. And I think that video just does a very good job within 10 minutes of describing that difference in the counseling approach from an Indigenous perspective.
Thank you, Nicole. The next question begins, thank you so much for doing this research. I am wondering if during the course of your research, you came upon any best practices for how to integrate use of traditional and Western medicine in a hospital or clinical setting. For example, does the Western doctor talk to the traditional healer? Do they note the use of traditional medicines in their chart? Is it okay for the doctor to ask about the medicine in order to screen the possible drug interaction?
Yeah, that's a great question. It's also a complex question depending on the community. I think there is regional differences, and it's important to respect the processes within the respective community that somebody operates. I will point people towards, and many people in Canada may already be aware, but I'm surprised often that they're not, is of Anishinaabe Health Toronto, or AHT, which is based in the downtown area of Toronto. It's one of the few places, at least operating really with an Indigenous health system structure, where Western providers are within that system. Both physicians and the traditional healers work together. In fact, they're on the same electronic medical record system. The traditional healers have helpers who input on that system, because it's not usually a way of doing things in terms of records, but they've actually come up with 10 traditional diagnostic terms that can be inputted into the electronic medical record system so that they can better coordinate the care between the Western-based providers and the Indigenous providers. And we've seen some research come out of Anishinaabe Health in terms of how they've been operating and doing that type of structure. There's also other examples, including South Central. The Navajo Nation has been absolutely amazing in some of their programming as well, which is based on wine. In fact, once this data comes out, you'll see a number in the Navajo Nation of examples where many times Indigenous physicians who have now come out, and I'm proud to see that we're seeing more Indigenous physicians come back and start to practice some of their ways within their own context. When it comes to non-Indigenous providers, however, there's a delicate balance, and this is where I say it's important to reflect with community and connect with community locally to ensure that the protocols for discussion around those medicines are properly followed. It may not be appropriate in one area to ask about the traditional medicines that the person is taking, but the community or the elders within the area may help to better define what the most appropriate way is to work together with them, whether or not it's developing official referral networks, whether or not it's just opening up communication between you. But because we can't take a pan-Indigenous approach, there's so much differences between communities. I don't want to state that there's one way to do this. The best way is to connect locally and get to know the elders and communities within the area that you practice.
Thank you very much, Nicole. Here's another question. Starts out saying, thank you, Nicole, such amazing research. Really anxious to read the research article. And the question is, do you plan on publishing a methods paper on the methodology you used for this research? I think the steps you took are necessary to ensure that Indigenous perspectives are included in research studies.
Yeah, sure. Well, funny enough, it was my biggest question mark when I submitted into a medical journal recently, and I was curious to see what was going to come back on it because I did not follow the checklist, as I had mentioned before, that's commonly required for review criteria, mainly because of the lack of critique of the articles. And interestingly enough, on the review, only one reviewer had came back and said, not necessarily anything against it, but just wanting more information and to describe it in a little bit more depth. So I think that speaks to your point about the importance of educating on that. And, I hadn't thought about it as a standalone article, but, I've got that on my radar now, thanks, to consider for future use. I mean, we need larger platforms, especially within medical journals that tend to be very conservative in terms of their publishing criteria, and not necessarily for the purposes of us needing to rationalize why we're doing something, but doing it from a place of education and honoring the system so that those institutions, those publishers have a better idea about our worldview and where we're coming from.
So our next question is there a way within the health system to compensate elders and knowledge keepers for providing traditional care to community members? Are there Canadian examples of integrated care that are funded universally?
Yeah, so this is different depending on the health system and the community. I know of certain health systems that have specifically hired what usually will be referred to as elders in residence, who are sometimes filling that role of the ceremony and some of the other integrative pieces within hospital system settings. What's unfortunate for me when I see job postings for elders in residence or other types of positions is that the monetary reimbursement for that are often very low. And many traditional healers will not accept money as a form of reciprocity for their services. So Anishinaabe Health Toronto in particular that I had talked about went through a very large process. In fact, the elder Bessa Blondin, who I had mentioned before, was one of the elders who facilitated the startup of Anishinaabe Health. And she told me stories about how there was large discussions around traditional healers, not necessarily wanting to break protocol for getting payment, but at the same time recognizing in the modern world that they need to buy gas to be able to go get their medicines. They need to be able to buy tools and supports these days to be able to do that. They need to pay their rent. So one of the things that they did was they would only accept a paycheck, at least at the beginning, if the organization told them what they had to buy. So let's say I want you to use this money for your rent, or I want you to use this money for your grandkids. And then that was an appropriate way that they got to ensure that the reciprocity was given, but at the same time, it felt better in terms of their protocols that they weren't taking money as part of that process. So I would like to see, and what I've heard is Anishinaabe Health Toronto does a very good job of even compensation between their traditional healers and their physicians, looking to them as equals within the healthcare system. Unfortunately, outside of elders and residents programs, I see very few health systems that have full-time employed what we would call or name as sort of a traditional support. Many are often funded by nonprofit organizations or otherwise, maybe perhaps in the First Nations Health Authority in BC. There's some specific examples. Again, I'm not from that region, so I'm not as familiar with that, but those are just some thoughts that come up in regards to payment facilitation, some of the issues that are involved with that, but also the importance of respectful compensation in traditional healers' knowledge base, which I feel is just as much, if not more, than our Western-based providers.
Thank you very much. Really valuable ideas. So here's another question. Since many of our traditional cosmologies are connected to language, do you know of any studies that also incorporate language reclamation as healing?
I think that's a great question. I attended a traditional healers gathering in Denver, Colorado in the fall of last year, and they brought healers from all over the States as well as some from Canada. And I specifically remember a Navajo traditional healer. And he stated a story about how this young woman had went into the emergency room and she was having a bit of a crisis, an emotional crisis, and she was in a state of panic and nobody could get her to calm down. They tried everything. They tried to bring in family. They tried to bring in elders. And this traditional person was called in, this traditional elder, to this young woman. And he said that he sat down beside her and all he did was he started speaking his language to her. And all of a sudden, she started to quiet down and she started to calm. And what he said is that the language is the connection back to our original selves. And automatically by doing that, I was connecting her to her elders, to her culture, to her ancestors, and she was able to recognize that. So I think that's a perfect example of how language can be used as a form of healing within our institutions. And right offhand, I know of one article in particular that looks at language as health, and I can't recall the name of the article off, but if somebody, whoever it is, sends me a message on that Twitter handle or Facebook or by email, I can dig it out and I'm happy to send it.
Thank you, Nicole. Here's a related question. Do you advocate for the oral tradition of these traditional Indigenous medicines rather than creating physical resources for practitioners? I feel that this oral transmission piece is incredibly important to maintain and embody our traditional ways of knowing. When we extract that medicine in a good way, it is preserved. What are your thoughts on this?
I completely agree. I think any of the teachings that I've received that have been, based on those original foundations of our knowledge system have always been in the form of stories or ceremony. I've never read anything in a book. I've never been allowed to write anything in terms of some of those sacred knowledges with that. So this is why this was such a delicate piece of writing, because it had to be done in a way that was just informing on existing information as opposed to creating anything new or passing on knowledge, with the reflection in mind that this was mainly geared towards a Western audience so that perhaps they might have a better idea or indicator of how these in our worldviews operate. But from within the Indigenous perspective, there's absolutely no need to write anything down. Our knowledge and our languages are connections to these systems and should be honored in that way. So I strongly support, and I'm hopeful that we're going to have more means and facilitated ways to be able to ensure that our youth are learning outside of the classrooms, away from physical entities, and are able to use their 2 ears as opposed to their mouth to be able to bring in some of this information in the way that it's supposed to be done, which is through that oral way.
Thank you, Nicole. What other barriers do you see that can inhibit the acceptance of traditional medicine?
I could probably go on for a while on this one. It's amazing to me sometimes when I think about the barriers that exist within institutional settings for the integration of this type of way of thinking. And, I can only speak to my experiences where I come from and in some of the institutions. And I will say that there's been a lot of movement within the last few years, and whether or not it was the result of the TRC or whether it was the result of, further information and advocacy on behalf of Indigenous peoples, I'm not sure. But the main barriers is policy barriers, because when it comes to institutional settings, it's all based on insurance liability. So you can imagine if somebody doesn't have a white piece of paper, and I say that very specifically, a degree or some sort of credentialing that enables them to practice a certain way within an institution, that automatically they're perceived to be a liability, especially if they're prescribing, if we could say in the Western words, prescribing something or giving some sort of health advice. So that's one of the biggest barriers I've seen, is that this indicator of liability perspective in traditional providers, that the Western systems think somehow that they're going to be putting patients at risk by not having these things in place, or they're opening themselves up to insurance claims. So this is probably one of the biggest ones. And, there needs to be work in this policy area done, because that is baseless in my mind in terms of patient choice. We're trying to move towards shared decision-making models in medicine, and that doesn't only include shared decision-making on the existing conventional care models and treatments that are available, but a shared decision model that includes all the possibilities for support and healing within that person's repertoire on who and what they want to engage in. However, I highlight that one because it is a big one that I often hear of.
Great. Thank you, Nicole. One of the attendees is working on a presentation for her university senate on why Indigenous medicine should be distributed for free in the academic world. What would be some arguments or evidence I could use to enrich my presentation on why Indigenous medicines are important for efficient quality of life in an Indigenous worldview?
Yeah, so I think, this goes to the point, and I really encourage when people, and I'm very proud to hear that students are taking up those initiatives in our institutions, is just remember that you do not have to rationalize your need or requirement. This is an automatic right as an Indigenous person. So don't forget that, because I think we get in the habit sometimes when it comes to these types of things where we're feeling that we need to prove, that we need to rationalize, that we need to provide evidence for, when in reality is that we have this right. It's innate within us. It exists within world conventions, whether or not it's the UN Declaration of Rights of Indigenous Peoples, or whether or not it's modifications put by the World Health Organization. Even the World Bank has one. And then, of course, within our TRC. So those fundamental pieces of wording, I guess, can be utilized for a powerful statement, but not, again, to have to prove a right for this access, but to demonstrate and to provide the strength of, from a strengths-based approach and not from a deficiency-based approach. I found that those types of approaches often work well in institutions, and it ensures that the dialogue that's created not theirs is that it's not somebody else deciding for us whether or not we have access to something. It is acknowledging a right. That's the advice I would give.
I have one quick question, I believe, that we'll end this session with. This individual is wondering if there were any articles in your review on sexual health in traditional medicine.
Yes, actually there was. And if I remember correctly, it was specifically in regards to using ceremony for sexual trauma. There was also a couple references that were used for cultural healing using Indigenous-based methods in there. And the articles are very specifically outlined within the database, and it has the word sex or sexual. So when the database comes out, you'll actually be able to hopefully search and find that or those specific articles.
Great, thank you. And so that concludes our session today. Let me reiterate my gratitude and appreciation, Nicole, for taking the time to share your incredibly valuable work with many people. I want to thank all of the attendees for coming and posing your questions. I'm sorry if I did not get to all of them, but do stay connected with the Collaborating Center, and we will try to facilitate any responses to any of those questions I missed. We wish to all of you, hi.